actual clinical setting. So a clerical type of environment is not going to count towards clinical experience, at least for our program. I think many others, yes, working in a medical environment as an EMT or a CNA or a scribe or something, that is a competitive clinical experience because you're the actual person who's providing the care. But like you said, every applicant doesn't have a situation where that's exactly feasible. So we count things like medical volunteering, if you're a hospital volunteer, nursing home volunteer, hospice volunteer, those sorts of things count towards clinical experiences. Shadowing physicians at any specialty will count towards clinical experience. I think for most of us, yes, those clinical experiences that put you closer to providing the care is going to be more competitive, but I think in general, it's about us understanding that you understand what the role of a physician is like and what the world of medicine is actually like. You don't think it's like Grey's Anatomy or something.
No, it's not. Oh, I'm so disappointed. Dude. Anyone else?
I think when you mentioned like the triplets in your job and things, I hear you, how you're expressing it right now is, I can't do this because of this. I can't. Tell us what you do here. What skills did you get from your job rather than saying, I couldn't do this because of that. If you start focusing on the excuses, that's probably not going to get you the new stage of the game. Focus on your strengths. Tell us about the job you're doing and the things you brought with you, and that's probably going to come across better than saying, triplets led to withdrawals, I couldn't do this because of that. So be careful as you express yourself on paper.
We notice though when someone's been working full time, then we kind of see like, okay, they have less clinical, but they've had a job for the last 5 years while they were going to school. So our committees are really careful to look at that, and they see that too. So, you can't have just zero clinical experience and just, they're not going to let that slide. But for someone, if they have a little bit less, but we do see that they've been working full time throughout school, then we give a little credit for that.
I'm lucky because I have some flexibility in my job. I just want to make sure I'm spending my time doing what you guys are looking for.
And what we really like to see, and I think other video schools too, is like what I was talking about, the direct patient care. So I'm working in a clinical setting, if you can shadow physicians to actually see what they're doing. Or if you're looking for volunteer opportunities, maybe try to focus on something where you're actually interacting with the patient, the direct patient care instead of working with a physician or just transporting patients. That doesn't hold as high of importance to us when we're reviewing applications as if you're actually in the trenches seeing what's going on.
Let me just tag on to that. You're going to find that you're not in the boat by yourself. Okay? DO schools are very welcoming to non-traditionals, as Amanda was saying. And not every kid that applies to a DO school has come through a pre-med track. We're very welcoming to kids that are from, heck, I've got construction management kids in my school, so, they just have to go back and get the pre-med. So not every kid is going to come up in a pre-med track where they're going to come with a CNA background or an EMT background. So the point is, I think what you're hearing is, do your best to get these experiences. As Luke said, focus on what you bring to the table, not what you don't bring to the table. And understand that there's a lot of people in that same boat with you, okay? But DO schools are really good at finding the value in you as an applicant versus, trying to figure out a way how to exclude you.
I think having the triplets is a strength.
Yeah.
You can say, I'm going to focus on your family, taking care of this. I care more about health care because of seeing all these experiences. You can actually use that as a strength.
It's going to be how you present yourself. Anyone else next? Okay, next question. And I'm going to tell you that we probably have time for 3 or 4 more questions, and then we're going to break up, and you guys can talk to us individually. Okay?
What are some pretty common mistakes that people make that we should avoid? It's kind of like some big red flags or big, no-nos that people do on their applications that kind of kill your chances.
Can I start out with that one?
We all have fun stories.
Right, we all see them. And we probably interpret that question differently. I mean, each school is going to interpret information a little bit differently. At my school, I'm telling people all the time, the biggest single mistake you'll make in your essay is to tell me why life was why you didn't have control of your life. In other words, you're telling us a story, right? And you're telling us why, Luke's example is why you couldn't do what you think you should have done.
The triplets were delivered by storks.
Right, exactly, or something like that. And the truth is, guys, and I get why you do it, I really do. Everybody has a story, and I think oftentimes you guys fall into this trap of thinking that you're the only one with that story. And the truth is, you're not. Everyone has a story. And the people that are reviewing you in the selection committee, for the most part, have gone through what you guys want to go through. I mean, a lot of the selection committees are physicians, right? And so they know that life happens, and yet you still got to go to med school, you still got to do well. You cannot use the excuse that med school is like a country western song where my dog died and the truck killed over and my refrigerator broke and, you know, that's my story. You still got to go to med school and do well. So what you really want to do is paint the scenario in the positive. So if you're telling me a story about whatever, grandma died of cancer and she was really close to you and you had to take a couple of semesters off to care for grandma before that, and because of that you didn't do well, whatever. If you're telling me that, I'm not interested in the fact that that scenario, quite frankly, caused you to drop in your GPA. You know what my committee's interested in? How'd you come out on the back end? Tell me how you grew as a human being because you actually went through that scenario. Don't tell me the circumstances. I mean, but don't focus on it. Tell me about what happened on the back end. Why your patients will benefit because you had to take care of grandma. Tell me that. My committee is really interested in that. I won't speak for everybody else.
You can mention when I dropped out of school for 2 semesters to take care of my
grandma. Yeah.
You just told us right there with the timeline what's going on without making the focus of the sentence.
Exactly. So to us, that's a big red flag to us, is that students or applicants try to present it in such a way that it almost reads like you're asking for special treatment or kind of playing the victimization thing, and my committee will just simply say pass. What we want to see is, here's how I grew from that experience. Here's what I take away from that experience. Here's how my patients could benefit because I went through it. That's really on the back end what our school is interested in that. And that is, quite frankly, on our school, probably the biggest mistake that you can make. Is presenting yourself that way. You get that thing? It's all how you present yourself, okay? Or a good portion of it. Who else wants to tag on to that question?
Get your letters of rec from people who actually like you. I know you. Yes, don't choose an instructor that you never went to their office hours and they don't know you, they just know you sat in the front row. Pick an instructor or like your pre-med advisor or your committee, but pick people that know you. Pick a physician that knows you and you shadowed a couple times and likes you well enough to write your letter. Because at least for us, if one of your letters of rec says, I don't recommend this person,
which they do all the time.
You're not going to get invited in for an interview. So choose wisely when you're choosing your letters of recommendation.
And ask them, do you feel like you can write a strong letter of recommendation for me? And if they hesitate or say no, don't have your feelings hurt, just move on, find another one. We read one time that the letter writer was like, I really don't know how they do with patients. They should probably be a radiologist where they're in their room by themselves. Whoa.
I used one in my presentations where the pre-med advisor came from an advisor letter. And I use it as what not to happen, right? And I've circled all this stuff. Like he says things like, I really can't recommend this individual. I really don't know him. I don't have a clue. In fact, I'll be really interested to see if he actually makes it through med school. All this kind of stuff is telling them. I actually called him and I said, is this code? He said, yeah. I was trying to be nice, but I probably might, between you and me, I can't recommend this kid. He was just trying to be nice to the kid, right? You don't want that letter. That letter's going to come, as you've heard, from someone who really knows you and can really talk about, and quite frankly, more than just your GPA and MCAT. They really want to talk about you as an individual.
Something we have a new dean, and he's very particular about too many science hours. Going overboard and 100+ science hours and then a 498 MCAT score. Those kinds of things are huge red flags. I think we've all talked about briefly, we really are looking for that well-rounded student, so just that student that has just been so focused on
well-rounded is something you hear a lot. A lot of times people don't define what that means. There's a good definition of it, right there. That you can be too focused in one area and not have experiences in another area.
I wouldn't say the maybe true for me, but admissions committees are often filled with PhDs on top of doctors, and they like the science, so it's a mixed balance. You're trying to get enough people on the admissions committee to raise their hand and say, I like you, and half of them may be science PhDs, in which case, yeah.
Yeah. So it's enough for us, particularly several meetings.
I'll take things in a different direction, is the interview day, when you come to interview on our campus, and I think all of us can talk about how we might have a little bit of a different interview process, but I think one thing that rings true is that you just have to be yourself on interview day. And we were kind of talking about before your application and trying to portray yourself in a certain way. I always find that whenever I'm working with applicants on interview day, is that the ones that are, I can tell they're just being themselves and being genuine. Yeah, they might still be nervous, but I'm still feeling like I'm getting a good snapshot of what this person is like. There's such a thing as being too eager and too, I call it like being eager beaver, like you're like, okay, you're just a little psychotic about making sure that you hit all of the right points. And the truth is that hitting the right points means being yourself and knowing your story and knowing what has brought you to this table, instead of thinking, oh, I read on studentdoctor.net that this school values this and this and this and this, so I gotta make sure I bring up this, I gotta make sure I shake this person's hand, I do this, just keep a air of professionalism, but also, don't be afraid to portray yourself in a way that is you, and not this kind of, unnamed, robotic, pre-med applicant that that a lot of pre-med students think that we feel is a big deal. That's not the case.
We're going to let the AT Still folks leave. They got to go someplace before they get down to BYU, so.
We left some brochures back here though in our business card, so if you guys have other questions that we can get to answer, I apologize, but you can definitely contact us. Thank you, sorry.
Thank you.
Thank you for coming.
Anyone else have a thought on that last question?
I'll just throw it out there. Have your personal statement for Fred. It's amazing how many phenomenal applications I get, and then I get to the personal statement, and it's just riddled with misspellings and poor punctuation, and I can't have my faculty members, my interviewers read those essays, because that would reflect poorly on my judgment. So please, you guys are all capable and you have good contacts. Have someone proofread your personal statement.
And have someone proofread that will be honest with you,
Yeah.
that's us.
Let me just tag on for, don't have it ghostwritten. You'd be surprised how many people do that. And you'd be surprised how easy it is to pick those out. We see it all the time. And it doesn't score any points with us. But you got to think of it in even more basic terms. Who better to tell your story than you? Think about that for a second. The odds are having someone else write that essay for you is going to work in your disadvantage. Okay? Anything else, guys, on essays or anything on the question? We probably have time for one more, and then we'll break up a little bit. Anyone have a final question for the panel?
Now or forever.
Now or forever, that's right.
Hopefully you guys are having fun with it, because if you're
Yeah.
not having fun with the process, I know it's long and painful, but still having fun with it, because that's what we want to see when you guys get to our doors, that you're still enjoying and want to be a physician, and you're still smiling about it somehow.
I guess, I know you guys are going to go with things, so maybe just briefly, like we just talked about the things to avoid, maybe personally for you. So you guys, each of you look through letters and things, right?
Yeah.
Okay. So maybe like something from personally you that you have come across and said, okay, when I see this, an applicant that has this quality or this kind of experience, what's one of your favorite things? And you say, okay, we're going to put this guy through.
I'll just basically echo what I said previously about the interview, which is that I am enthusiastically going to recommend somebody if when I read through their application, I see that they're genuinely moving down this track. That everything that they've poured into their application is a reflection of the themselves. I could line up 10 different applications that have 10 different types of things that all mix together to make that same genuine applicant. But hopefully you've been gaining these experiences of taking these classes and volunteering and all this, not just because you want to fill things out on an application, but because you feel like you are, I know it sounds cheesy, but like you feel like you were called to move in that direction. And I think that if I can see that in someone's application, that they're not just trying to check these boxes, that I get a real sense of who this individual is when I look at their application. That's what stands out. And like I said, it's a completely different mix from student to student. There's not one quality or one experience that sets them apart, but I just know that what I'm getting is the real deal and not somebody who's trying to fake their way through it or tell me what they think I want to hear. That's the biggest thing I look for.
During our welcome week every year, the dean gives a welcome speech to the students. She doesn't say, we have a class of 100 students, all with 3.60 GPA. She goes, we have a steel worker, an Olympic athlete, and a person, whatever it may be. She lists the different qualities of people that make up the class. So you gotta still be yourself in the midst of checking all those boxes. If you get lost just in science classes, that's probably not gonna get you indoors. So whatever you're doing along the way, still enjoy life. If you have to find some volunteering or some service or find what works for you, so maybe it's a unique experience, that's okay. You guys are smart enough to know what a good experience is, whether it's clinical or not. So don't be cookie cutter.
Understand that enriches our schools. To have that diversity in experience, it enriches the class. What we look for in that topic is, we come from an understanding that the more diversity we have in the class, the more opportunity you learn to relate to your future patient population, right? Because they're not all going to be like you, right? So it really does enrich all of our schools to have this diversity within experience.
How terrible would that be? Being a doctor, only having you come through the door over and over again.
Anyone else? But, that's the truth is for all of us, it's going to be different for the applicant. We're all looking for the stuff that we've all talked about. We want you to be you. I've already got Bobby. I don't need another Bobby. I need the best you that you can be. That kind of thing. Okay. One final thing I'll mention, and I know we all go through this because you're going to write both a primary application essay and a secondary application essay. Guys, stop. And these guys can chime in if they disagree on this one, but stop trying to figure out what you think we want to hear and tell us what you want us to know. We can pick those out. We can pick the essays out where the person is just simply trying to say what they think we want to hear. And it doesn't give us a profile of you. It really doesn't tell us anything about you. Tell us what you want us to know about you. That's what Luke's talking about. Tell us who you really are. Okay? And get off student doc. If you're on student doc, get off of it. If you really go on student doc and look, the vast majority of that is just garbage. Vast majority of people posting on that, vast majority, not in every case, but there are people that we have denied, now they're mad at us. And so they're just going to discredit the schools. Get off of there. If you really want to know how to get into a med school, call these people up and ask them. We'll tell you how to get into our schools.
But call Mike more than the rest of us.
The point is, do you really want to know that information from someone who's been denied and now is disgruntled over that, or do you really want to take it from the source?
We're not going to lie to you, I swear.
Exactly.
But personal thing is one flowing story where it's just you telling your story is better than, don't make it be a list.
Yeah.
People get like, I did this, I did that.
The bullet point, don't do that. Yeah, it doesn't flow. Okay. We are going to slowly pack up. So now's your chance to come and ask us specific questions about our individual schools, and then we're going to need to get out of here fairly quickly. So thanks for coming, guys. Appreciate it.
You guys.